Just a quick introduction. I am Dr. Michelle Maegly. I am a clinical psychologist, graduated from Xavier, got my internship completed at the Lexington VA, worked at Talbot House for a minute, worked at the State Psychiatric Hospital for about 12 years until I made the transition into private practice. I've been doing private practice full time for going on 3 years. And early on, this became an area of interest of mine, partly because of just being clinically interested, but also because of the folks who kept coming to me for help. So we are going to get started here. I am employed by Hello Mental Health, and I believe Andrea, our practice coordinator, has put some information in the chat for you. If you could hold your questions until the end, we don't have somebody who is able to moderate right now, so I will be pulling up the chat toward the end and be happy to answer any questions that you have at that point. We'll make sure to leave time. Okay, so what we're going to be talking about today is a little bit about what survivors experience. I know that there is a large zeitgeist, a lot of social media buzz about narcissism and narcissistic abuse. So I want to clarify some of the things that survivors do experience. And then we're mainly going to focus on what are some of the common treatment targets and techniques that we want to utilize with this population. Most importantly, however, I think is really thinking about and acknowledging what mistakes traditional therapy might lead us into making with the folks that we are engaging in this work with. So a brief note about language. I think language is extremely important. And I think, as a clinician, sometimes we get hung up on the very ethical concept that we can't diagnose people that we're not working with. So there may be a resistance to allowing a client to use the term narcissistic. The way the experts in the field look at it is that narcissism, much like kindness, is on a continuum. So somebody may be really high in narcissism, somebody may be very low in narcissism. That doesn't mean that we're providing a diagnosis or that we're even stating that somebody has the personality disorder. In session, in practicality, I oftentimes have people identifying that when they come in because it's advertised as a niche of mine that I work with. So they'll come in knowing that this is the issue they want to work on. So they're very savvy with language. However, for folks who may be discovering it through the course of treatment, it's not something I typically bring up first. I will use language like, seems like the personality style is one that doesn't work well with yours. Let's talk more about that. I'll take personality pattern instead of so really, I try not to get too hung up on language, because when I police language, or if we were to police language, it can be very invalidating and kind of miss the mark in terms of what the point is of them seeking our help. You'll also see in some of the literature, as well as in this presentation, the idea of antagonistic relationship stress. This is a replacement, or it is able to flip-flop between narcissistic abuse and antagonistic relationship stress. They kind of mean the same thing. I think some places narcissistic abuse is more warranted as the language to use. It replaces the antagonistic relationship. And we will be getting into what we mean when we say antagonistic. All right, so I mentioned that, we know that this is all over social media, and this is a creator, Jimmy Knowles, that does a lot of content based on healthy relationships and attachment and things like that. He does seem to be a credible source, and I think that his videos are really easy to digest and quite funny, so I wanted to share this one with you.
Hey, it's great
There
to
we go.
meet you. Oh, thank you so much. Yeah, you too. So I'm a narcissist. Yeah, but you seem so nice. Oh, I'm pretending. Really? Yeah, I figured out if I'm charming and funny and give you lots of attention and affection, then I can get you to fall in love with me. Why do you need me to fall in love with you? Oh, because then you're less likely to leave once I start lying and belittling and gaslighting you and chipping away at your self-worth in order to control and manipulate you. Huh. Yeah, it works especially well if you have a history of trauma where you tend to blame yourself even though you're the one being neglected. That sounds like abuse. Oh, it definitely is. Why would you do that? Oh, I'm deeply insecure. I can see that. Yeah, I have a massively fragile ego and a fear of rejection, so I've created a fantasy world in which I'm the center of the universe and everyone else is inferior. Wow. Yeah. Well, thank you for telling me all this up front before we formed a complicated trauma bond that would have caused me years of misery. Yeah, well, I just want people to know what they're getting into. I mean, you by chance don't struggle with a lack of boundaries and self-esteem issues, do you? I do, actually. Dang it. We probably would have made a great pair. Yeah, I bet. Good thing you showed me these red flags up front so I could protect myself. Well, if there's one thing I am, it's honest and transparent in the beginning.
And you can't see it behind there, but it says, said no narcissist ever. So I want to talk about the core elements of narcissism, and I'm not going to spend too much time on this because I'm sure many of you are aware of these core elements. When we think about empathy impairment, sometimes I will have clients come in and say, my partner, my parent, my child, they seem to have empathy. They seem to understand what's going on. And one thing that I point out to them is that people can demonstrate cognitive empathy, so an intellectual comprehension, more so than emotional empathy. So they don't necessarily have the capacity to feel and share someone's emotions on a deeper level. They may also display performative empathy, so displaying empathy outwardly through words or actions without necessarily feeling it. So it's not just absence of empathy, it is the impairment. We certainly understand entitlement, putting their needs first. This often leads to double standards, disregard for boundaries and limits, expecting accommodation, often responding with angry, frustrated behavior, becoming resentful anytime their entitlement to something is thwarted. Need for admiration, we certainly know what that one is. Superficial relationships. So our folks that are coming to us might say, the relationship just seems transactional. It seems to be just about what she can get out of me. And yeah, that's the case. So there's not any foundation of trust or intimacy with this one. Emotional fragility. So this is that sensitivity to criticism, the withdrawal, the passive aggressive behavior. Oftentimes people high in narcissism associate vulnerability with loss of control or rejection. So they use those defense mechanisms to protect their fragility, like the blame shifting and devaluing others. And the grandiosity. So with grandiosity, typically we think of it as that overconfidence, arrogance, seeking admiration. That would be the textbook narcissist, what we often see with the diagnostic criteria. However, many people can be high in narcissism, but really fly under the radar because of their lack of overt grandiosity. We will sometimes call those vulnerable narcissists, or you might hear the term covert narcissist. So this is marked by being hypersensitive to criticism, high in insecurity, introverted, feeling inadequate. But instead of concealing that inadequacy behind this charming outward appearance, this mask of arrogance, what is actually being shown to us is that they're very self-pitying and defensive, and the world is against me. And if only people could see how good I am, then I would be getting ahead in the world. And they often seek validation in subtle or passive ways. They may use like a disingenuous put down to themselves in order to elicit a compliment or to feed their ego from you. All right, so this is another one. I think this is a great slide. I went back and forth over what to call narcissists. Sorry, not narcissists, but the people who get involved in narcissists. When we say the word survivor, and you will hear me say that, it tends to imply that somebody has moved on, they have survived the relationship. When really it is oftentimes a present tense situation. They come to therapy while they are still in these relationships, or these are relationships that they feel they can't end. Maybe it's a parent, maybe it's a child. So this is just a comment that I wanted to make. It doesn't have much to do with the video, but it came to my mind just now.
Oh, thank you. So we've been going out for a little while, yeah. And if I'm being honest, everything has been really great. Well, I certainly hope so. I've been love bombing you pretty hard. So I just have a couple questions for you. Uh-oh, should I be scared? Nah, it's just standard questions that expose narcissists. Number one, name any example of when you were vulnerable or empathetic towards someone. What's that? Number two, what do you do if someone gives you constructive feedback? Lash out in rage. I mean, listen. I would listen, of course, to their perspective. Number three, when's the last time you were wrong about anything? Well, that's a tough one because I'm never wrong. So, of course not. What steps are you taking to improve your relational dynamics? Relational what now? What responsibility do you personally take for your last relationship ending? None. It was all their fault. I was the victim. I did everything I could, but they just kept taking advantage of my kindness. Who deserves the most praise and admiration in the room? Oh, that's me. That's an easy one. If I told you my insecurities, fears, and vulnerabilities, use them against you. I hadn't finished the question yet. I'm sorry, what?
All right. Um, One thing that I think is interesting that I just noticed about this video, I know that he's absolutely role playing, he does a great job, but he shows that narcissists or people high in narcissism will certainly know the right answers to these questions. It would be great if we could go down a checklist, but especially if they're savvy and you're trying to assess where they are on this spectrum, they may just be able to say, oh, yeah, I definitely want to work it out, or I believe in mutual respect, or yeah, I want to share household tasks in the family. I'm not going to put it all on you. They can have the language, but they don't follow through.
Oh, thank you.
Oops. All right. So getting into the meat and the main reason why that you are here, we're going to be talking about how do we help. Um, I had the obligatory cute photo on there. I went to find something, a graphic that just illustrated helping, and this one popped up, and it was just too irresistible. I had to show it. All right, so three core treatment factors that we are going to focus on. When we're working with narcissists, we have to remain trauma informed. We have to become, if we're not already, antagonism informed. And we want to realize the huge role that psychoeducation plays in the healing of the folks we're working with. So with trauma informed, this is probably familiar to most of you. The pillars are really somebody feeling safe, feeling as though they have choices in the room, feeling it's truly a collaborative relationship. And this may show up as something as simple as you might recommend they come in every week, but they're saying that they can only spare the time for every other week. With somebody who is in one of these relationships or healing from one, we don't want to push our agenda onto them, even if we think it is for their best. We don't want to take a prescriptive tone. Certainly trustworthiness and empowerment. The trauma-informed framework will always be useful with these clients, regardless of whether or not we may clinically think they meet the bar on what qualifies as trauma. When somebody is in a relationship that's on the milder end of narcissistic abuse, they may feel even farther from calling what they're experiencing trauma. And they may have a greater capacity to discuss what they're experiencing without being flooded. But for others, it very much creates the same fight, flight, freeze, fawn response, and it can be very somatically held, just like with other survivors of trauma. So some of the interventions dealing with the body and with somatic healing can certainly be helpful here. But my thinking and thinking of experts in the field is that you stay trauma informed. We hope that we're being trauma informed with most of the folks that we work with, if not everybody. And it's not really about whether or not we think they meet the bar. So what about antagonism informed? This is not a term that I was aware of until I started getting into this area of interest. So antagonism informed therapy for narcissistic abuse is essentially an approach that recognizes the manipulative and exploitative and coercive nature of narcissistic abuse. And we are ensuring that therapy is not reinforcing those harmful dynamics. So oftentimes these dynamics are more subtle, and we need to just be cautious about it. So some key aspects We, especially early on in the therapeutic process, we want to focus on helping them understand and exploring what is keeping them stuck in the relationship if they haven't already moved away from it. So that staying stuck, that staying entangled is really what is most important. Um, it's as a therapist, it's always interesting to hear about the origin story, like how did this come about? But early on in the therapeutic relationship, focusing on the getting stuck can be extremely shame inducing. We don't want to talk about red flags that were missed. We don't want to talk about how they got entangled, or what do they recognize looking back. That might come, and it will certainly usually come later in therapy, partly when you're talking about prevention and continuing to heal. But the staying stuck is where we want to focus. In antagonism informed therapy, we're also recognizing the power and control dynamics in these relationships. So the relationship isn't just dysfunctional, it is one-sided, and there is manipulation and there is harm. We need to make sure the therapy that we're engaging in avoids blaming the survivor for the abuser's behavior. And I want to give you an example of a time that I experienced this. When I first started getting interested in this topic, it really came from a client that was referred to me. So a different psychologist had referred this woman, and she was post-divorce from her husband. She did not want the divorce. The mediation was a horrible process, and she wanted to understand how she could get her former partner to work better with her as a co-parent. So the previous therapist in the referral sent me a note saying that this client needed a lot of validation and did not respond well to challenging. And I'm like, okay, I can do that. Let's see how this works. So as we started working together, I realized how much shame and how much anger this client had. And I took the previous therapist's advice and I really steered clear of challenging. Challenges that I might have used are, how do you think that your ex felt when you said those words? Or how do you think your response to his attack might have added gasoline to the fire? We may have those conversations, and those questions are certainly valuable when it is a mutually balanced relationship. When you're working with a survivor of narcissism, this is not helpful. We don't want to blame the survivor for the abuser's behavior. So in working with that client over time, she actually came to me and said, "Hey, I read this book. I think you should read it. It describes my relationship with him to a T." And the book she gave me was The Covert Passive Aggressive Narcissist. I read it. It was amazing. It was a great book. I learned a lot of how she saw the relationship, and we really turned a corner in my ability to help facilitate her healing and the work that she was able to do. So related to that is validating someone's reality. We want to understand the impact that gaslighting has on folks and how much it leads them to not trust themselves. We want to recognize that not only might they not trust themselves now, but they have a fear that they will never be trustworthy. I will never have the confidence I used to have. I will never be able to make my own decisions in the future. That this is a real fear that we have to help them through. Again, I mentioned this earlier, but avoiding that neutrality. Common conflict resolution models may actually be dangerous. When we ask someone, you need to set boundaries, or which you still do, but sometimes the way that we help a person decide to do that, we may not be recognizing how dangerous the situation is. Boundary setting may look very different for a survivor of narcissistic abuse than it does for somebody in a different relationship. So, encouraging them to compromise or to reconcile, or to think about their role in things, this can be very harmful. When I think about just some of the basic conflict resolution skills that I have used before, one of them comes to mind, and that's the DEAR skill from DBT, where you describe, express, assert or ask, and reinforce. I actually was teaching that to a couple, and I had a hankering, an inkling that the person one of the partners may have been high in narcissism. And when I described the model, the person who ended up definitely had high narcissism said, "You want me to pander to her?" It's like, oh wow, that told me a lot. That told me a lot. So we don't want to encourage that. We also want to understand why leaving is emotionally difficult and to explain to them the processes that make it emotionally difficult to leave. And I'll show you those in just a moment. And we also want to be aware of and prioritize safety and autonomy, that there is a potential for retaliation, stalking, post-separation abuse. We want to be aware of that. We may be the ones asking the questions, bringing it up, and helping the folks that we're working with create a plan to mitigate that. But the main thing about antagonism is that it's not a communication issue. It's a power struggle where the survivor is systematically harmed. And this approach ensures that therapy is validating, safe, empowering, without fostering a false hope that the abuser will change. And that can be a big component, is helping the folks we're working with come to realize that the hope may be misplaced. Often is. So in terms of the specific treatment approach, we are going to be attuning, collaborating, validating, obviously. We're going to be doing a heavy dose of psychoeducation, though we want to be careful that psychoeducation can trigger some blame, or not blame, some shame, some self-blame. We'll get into that in a moment. A lot of the work we're going to be doing is helping them accept the person for who they are. I don't mean stay with them, but certainly not have that hope that they're going to magically change, to shift their schemas. We also need to help them understand some practical issues like family court, finances, risks of violence, like I mentioned before. And then we're going to be moving into more growth and individuation. Now, certainly, this is not a linear process. I wish it was. It'd be great. It'd be simple. We could follow this as a roadmap, but this is more a jumble, a Venn diagram per se to the work that we're doing. And when it comes to the approach with addressing schemas and acceptance, growth, individuation, the current therapeutic techniques that you may use are going to be extremely helpful in these areas. We just have to look at them through that antagonism informed lens to make sure that we're not making some of those mistakes we earlier mentioned. All right. So part of psychoeducation can help an individual understand what the fallout is of their narcissistic abuse experience. So when we look at an adult's fallout and what they may experience, we see chronic self-doubt, hypervigilance, and anxiety. This might look like emotional unpredictability, fear of conflict or criticism. I've had people come to me saying like my partner's telling me that I'm the narcissist. I'm really worried about that. Sometimes I do blow up at her or at him. And that really speaks to that emotional unpredictability. There are often attachment issues, struggles with leaving that relationship. There has been an erosion of their identity, tendency toward people pleasing, always prioritizing that other person's need over their own. I met with somebody earlier this week, and this really popped in for her. She was in an adult relationship with a narcissistic boyfriend. The relationship is over, but she was recounting some of the things that she experienced. And she talked about a time where he was instituting a double standard, extremely common. And she said, I just kept thinking that he must be really hurt inside to ask me this. And I said, okay, I get it. You want to be empathic. It makes sense that you would wonder why he's doing this. But what was the actual impact of his ask or his insistence on you? She goes, oh, what? I didn't even think about that. Like, yeah, you were putting empathizing with him over protecting yourself. And you were getting ready to just do what it was that he was pushing you to do. And the important part that I followed up with is that that is extremely natural for kind, empathic, caring people. We want to make sure that we are never underlining the idea that they're stupid to be in this relationship or they should have known better. They're beating up on themselves, even if they're not saying it out loud. So I often turn back to because you're such a caring person or because you're somebody who takes relationships seriously and you want to look at your own behavior and you want to see what it is that you could change to improve things, but you're doing it one-sided. Sometimes that's the education that we give. And then oftentimes it can lead to PTSD or complex PTSD symptoms. So the adult fallout is a little bit different than the childhood fallout. So in childhood, and I only work with adults, so I'm talking about how childhood narcissistic relationships show up in adulthood. So oftentimes there's a lot of insecure attachment styles, so fear of abandonment, emotional unavailability, problems even knowing how they feel about things or how to say it. Oftentimes they were not allowed to express any feelings to a narcissistic parent because the child's strong feelings were completely inconvenient to the parent. The parent didn't really care. There's role confusion. So the person you're working with might be overly parentified, or they might have been the scapegoat in the family dynamics. Like if you weren't so selfish, if you hadn't done this, if you hadn't made this mistake in school, then I would have been able to dot, dot, dot. There's oftentimes that overdeveloped empathy and that phonic. So again, prioritizing others at the expense of the entire self. Um, and this is not just with the narcissistic individual, but on a very broad scale. Difficulty establishing any type of identity, which is a bit different than with an adult who may need to rediscover their identity, rediscover their autonomy and self-worth. For childhood survivors, they often never got a chance to do that. And thus, this leads to a much higher risk of these individuals being re-victimized because of the dynamics that it sets up intrapersonally for that individual. All right. So the relationship cycle is pretty predictable. And this is also a component of psychoeducation that we often give because folks will come to us and say they were amazing in the beginning. I mean, we know it now as love bombing, that language is all over social media, but it's that excessive attention, affection, admiration, creating this deep sense of connection. I had another client yesterday tell me, she says, you know what? When I sat there in one of our first dates and told him exactly what I was looking for in a relationship, I thought I was being upfront. I thought I was being transparent. And I thought that if he didn't want those same things, that he would walk. Like, yeah, because you were sharing in good faith. He was not. He was data collecting. He was, trying to find out things that he could and then definitely would use later in the relationship against her. So they're trying to gain your trust, your emotional investment, while they're hiding those red flags. And that's how I say it to individuals. It's not that they missed the red flags, and sometimes we miss them, right? But the narcissist is also really good at hiding the red flags, and it's important to acknowledge that. So the next phase that folks experience oftentimes is that devaluation, when they're critical, distant, manipulative, engaging in these push-pull dynamics, having the individual question themselves. They try even harder to regain the approval. And why do they do this? Well, they're trying to control. And when they go back and forth between seeming to validate you and then assert control, seeming to validate, assert control, it breaks person's sense of self-worth. And then inevitably we lead to a discard phase. Now, the survivor may leave the narcissist, so it interrupts the cycle a bit, but most of the time there is still a discard phase. So they may abruptly discard a person, Or the discard happens within the relationship. They start not responding, silent treatment, becoming indifferent, not caring about what you're doing. This is a point where they might start trying to get validation and replace our person with somebody else. They may turn to infidelity. They may set up a backup plan while this is happening. And essentially, once they have pulled enough energy out of the survivor, then they just kind of lose interest or they punish you. It's just another way to get the supply that they need. Um, and then there is a bonus phase I didn't put on here because it's not always present, but you might have heard the term hoovering. So hoovering is essentially when they return post discard, apologize, and try to rope you into the cycle again. So when we think about staying stuck, this is an area that we often have to validate for our clients, telling them that it makes sense that they were stuck. And these are the components that ensure that folks stay stuck. So first of all, the trauma often happens early on in life, but even if it's in adulthood, it impacts the person's sense of safety and where they get support. So then they get more bonded with the individual. There are cycles of abuse and intermittent love bombing or positive reinforcement. And we know that reinforcement and abuse, they keep, we keep going back for more. It's the slot machine schedule of reinforcement. But then it disrupts perceptions of what love is. They may have been punished for their disloyalty. And then folks fall into a process of betrayal blindness. So this is essentially ignoring or failing to ignore or failing to recognize betrayals that happen because it's too dangerous to acknowledge that conflict, that loss of support. So they suppress, they forget, they excuse, and they may not even realize it till much later on how much betrayal there actually was. And then, of course, cognitive dissonance. Many of us learned this early in our training, but explaining this to our clients helps them see that, again, they were not stupid. It wasn't that they missed something. They were biased toward giving the benefit doubt because they care, because they're empathic, because they want relationships to work, because they believe in love, all of those things. These are things we want them to continue to do. It's just they happen to get hooked by the wrong person. Okay, so I want to talk a little bit about some of the key behaviors that the antagonizer displays. Oftentimes we will have to define these to the clients that we're working with. We need to explain them to them. So I'm going to highlight them pretty quick. We talked about the love bombing and devaluation, the hoovering we mentioned when they're trying to rehook them after discarding. Silent treatment and stonewalling. This is definitely behaviors that partners will use to punish. And that's one thing that I help them distinguish is they might say, well, I just thought he was cooling off. Okay, cooling off. Yes, absolutely. I teach that skill in my couples therapy. I teach it to individuals. Yes, take a time out, step away. You don't want to stay engaged, but we need to look about what's the purpose. Are they willfully one-sidedly stonewalling you to punish you because you said or did something they didn't like? Or are they cooling off to get themselves in a better position to have a healthy discussion? Triangulation, this is when they pull in the others. Well, my mom says that you don't dress well enough to attend family events. I actually had a client tell me that. It might be, well, my therapist says that you're the narcissist. They're pulling in those other people, which then can lead to further self-doubt of our client. Like, I thought I got along with your mom, or I thought your brother-in-law liked me. He seems so supportive. See, it's breaking down that support system as well. Greek chorus and flying monkeys. Some of you may have heard of the flying monkeys. They're essentially the individuals that do the dirty work of the narcissist. They might be complicit in the abuse, or they might be excusing the narcissist. It can be more and more crazy making for the survivor we're working with. The Greek chorus is a little bit different. These are the people who say, you really should work on it, or family's family, you should give your mom another chance. Well-meaning, but they don't know all the dynamics. Future faking. This is when an individual says, I'm going to go to therapy. I'm just too busy right now. Or you know what? When I'm retired, we're going to travel like you always wanted to. It's essentially holding that carrot, kicking the can down the road, like, I'll reward you later, just stick around. I'll reward you later, just stick around. Moving the goalpost. Most of us know what that is. Coercive control, gaslighting, and Darvo. So I want to just highlight some ways of gaslighting. This is the movie poster from the original movie. I'm not going to go into it, but it's great. It's the reason we say the word gaslight. But these are some phrases that in isolation might not be that toxic. In pattern that erodes, absolutely toxic. And what is DARVO? DARVO is one of these, it's an acronym for defend, attack, and reverse victim and offender. This is one that some of my clients really like, they like to hang on to. So it's when person says, I didn't do that. You're the one who did that. And I can't believe you're even coming at me with this after the week that I've had. So it's that real slick turning the tables. So I'm not going to go into this just for time's sake, but it is going to be available to you afterward. There are areas that we want to assess when it comes to the impact of the narcissistic abuse that folks experience. So certainly some practical factors and stakes that a person may have to keep them engaged or to pressure them to stay. We certainly want to assess their experiences that they have had in these domains related to the NARS. There are the key treatment areas of focus. These are the things we want to know. How much are they doing these things? How much do these patterns plague them? And how can we work on these areas of focus? And then what are some of the fears? Are they fearing that they're the problem, or that they can't do anything without that person, or that they're the ones going crazy? And as we're working with them, we want to continue ongoing assessment of, what is this person's line, especially if they still are engaging with the narcissist. Is it infidelity? Is it, if the person gets physically violent? Is it they become violent toward a pet or toward a child? These are the things that we want to know so we are prepared when our client's person butts up against the line. And then understanding what are some of their relationship constructs? How do they define love? What do they think love is about? Is it about submission? Is it about complete self-sacrifice? Those are some schemas that we may want to be aware of so we can down the line challenge them, or at least help our person understand why when it's happening too much, it actually is harmful. And then sometimes it's helpful to understand what goes on in our client's typical day. Are there times of day that are easier for them to cope versus lower? Are there situations that are going to be more volatile? Are there patterns to what goes on in the relationship? And what would they like to be different? Okay, so some of the core treatment targets. The rumination and the self-doubt. We want to gently affirm when we're challenging decisions, really paying attention to how gentle we're being. We want to validate. It makes sense that you're questioning things given what you've been through, validating that reality, rebuilding their confidence in themselves. When we're challenging, and I can't say this enough, that's why I'm saying it again, we want to be gentle. We don't want to become the expert in the room, like you shouldn't think that way. We are also going to be seeing a lot of anxiety and self-blame. So we need to gently check in, help them rebuild confidence in their intuition. We don't want to impose our own narrative. We need to help them process their guilt and really be compassionate with themselves. A woman that recently started working with me. She had a narcissistic father as well as just got out of a recently abusive relationship. And as she was telling the story of the abuse, she kept saying, "Oh God, I just hate myself. I don't even like to say this out loud. I hate myself so much." And then later, because she's a very results thinker, she goes, "How will I know when I'm getting better?" And I said, when you aren't saying that you hate yourself, it's going to be one thing I'm looking for. She's like, oh yeah, I'm not, I'm not very kind to myself. I'm like, no, we're going to help you with that. We're also going to be looking at identity erosion and individuation, might be connecting them with their personal values, encouraging them to reclaim themselves. And then we're certainly going to be helping them with those PTSD symptoms that may be showing up. And any therapeutic techniques that you use, whether it's CBT, DBT, ACT, psychodynamic therapy, feminist-based therapy, you can use those techniques in these areas. It's just thinking about those caveats that we mentioned before. And then there are some specific treatment techniques that we may help them with. One is helping them recognize whether it's scanning their body or checking in with themselves when they are feeling depleted, when they are cognitively overloaded and they need some more clarity. We may also teach them to gray rock or help them work through the idea of going no contact. Certainly not something I prescribe, but something that many people want to talk through. So gray rock is essentially if the narcissist is feeding on your emotional expression, your volatility, the drama, be as boring as a gray rock. And we just kind of walk through what that might look like. We have to be careful because we may be asking them to go against their genuine self. So if they're normally polite, it's okay to be polite. We're not going to be like, I completely like gray rock. We don't want to necessarily do that, but helping them own it and see what works for them. We can help them with sort of emotional firewalling. Just like with computer language, we're putting up a boundary to protect self-worth. We're going to need to teach them techniques to manage distress. So this could be those tolerance skills, mindfulness, self-trust, reality anchoring, helping them rebuild some of their social supports to give them some reality testing, to validate their reality, using journaling, etc. And then we want to make sure that we are not forcing any premature decisions for them. We may feel that this is a horrible relationship for them and doing damage every single day they're in it, but we can't be that expert in the room telling them that they need to move on for their own good. Another thing I like to teach is to avoid deep interactions with the narcissist. So deep stands for, getting into that, defending yourself. Well, I did it because of this. Explaining, well, I wouldn't have known because they didn't make the school schedule yet. Engaging about it, continuing to answer questions, and then personalizing the response that you get from the narcissist. So I try to absolve them of these demands that they place on themselves or the narcissist placed on them. You don't have to defend yourself. You don't have to explain yourself. You can disengage and please don't personalize the insults that might be thrown your way. And then there are some challenges that our survivors are going to be trying to work through with you. One is the fear of leaving versus the fear of staying. Sometimes leaving has many more barriers to staying. And we may have to help them work through that. And it may be that they end up saying, you know what, I want to maintain this relationship. I just have to know how to survive within it. And so we work with them on that. Internalizing gaslighting, or sorry, internalized gaslighting. So they may be long gone from that manipulative relationship, but they're still not trusting themselves. They're still saying, oh, I'm being too dramatic, or I'm probably being overly emotional with this. And we have to be that voice that says, whose voice is that? Is that your thought? Or is that something that you heard from that other person over and over again? And it's usually the latter. Also, some people who are familiar with codependency may see um, some of the behaviors of a narcissistic abuse survivor as codependent. However, I think that that material, though it may resonate with some folks, can pathologize the survivor's response. So these are normal responses to an abnormal situation, not their need to be entangled with somebody who shows pathology. And then we also need to help them navigate the pendulum swing, that fluctuation between seeking independence and longing for the relationship. And this is one reason why so many people go back to these relationships. It's because they pull away and then they get sucked back in, not just because the narcissist is trying to hoover them back, but because they do miss that person that was an important person to them, or maybe they feel obligation. Maybe the pendulum swings when they find out that their narcissistic mother is now in hospice. We have to help them navigate these ebbs and flows of contact or attention or sadness, grief, all of those things. And then when our clients choose to remain, um, we want to help them accept that no matter how hard they work, they might not influence and probably won't influence to a high degree their person's behavior, and helping them see that they may have to be taking on more to help themselves rather than continuing to engage in exhausting and circular arguments with the narcissist about how they need more support from them. So it's about strategically detaching from some of these concepts and setting boundaries. We may have to, or we may see benefit in helping them find small ways to reclaim their autonomy. We may not, help them find an apartment and get out of there, but maybe instead of putting 100% of your paycheck into the joint account, maybe you have a little financial planning of your own and put some somewhere else, that kind of thing. Or, you know, your partner's at work all day and you've been really lonely. What would it be like to try to reconnect with some of your friends in the neighborhood? Would that work? What do you think about that? So sometimes it's that gentle, encouraging them to reassert some of that autonomy. And then even if they choose to stay, we may choose to help them build an exit plan if they ever do decide to leave. So that's one reason why it might be researching custody laws or setting aside some money, reconnecting with supports. That can be all components of an exit plan that they then might be able to utilize if they do choose to end the relationship. All right. So this is a presentation that I cut down from a 2-hour presentation that I did earlier. And one thing I just realized that I left out is how much grief work that is done in this type of work. We are helping them certainly grieve relationships. Sometimes it could be grieving the closeness they thought they could have with a child when a person's child shows high narcissistic traits. It may be certainly helping them grieve a romantic relationship or a friendship that they thought was balanced and working, and they discover it isn't. But we also have to help them grieve time lost and elements of themselves that they have lost. It doesn't mean that they can't get it back, but it might mean that we have to help them work through those feelings of sadness and guilt associated with the loss itself. When we are working with childhood survivors of parental narcissistic abuse, grief is also a huge component in terms of grieving the parent you didn't get to have, grieving the childhood you didn't get to have, grieving the fact that all of these adult responsibilities were put on your shoulders. So there's a lot of grief work that happens in this work. All right. So I'm also going to have some resources. I have a resource slide here. Social media, I can't stress enough how much good content there is out there. I know a lot of folks get uh, worried about the misinformation. Certainly, we need to think about that. That's why I put together some of the usernames for TikTok content creators that have really thoughtful, lived experience. You can tell that they've done their research, they've gotten education on these areas. And I also recommend several different podcasts and YouTube creators. So many of you might be familiar with Dr. Ramani Devrasalov. She is one of the biggest names in narcissistic abuse treatment. And she has a lot of great, accessible, non-jargony information on her YouTube channel. And she has a podcast called Navigating Narcissism. And then another psychologist, Dr. Les Carter, he has a great podcast called Surviving Narcissism. Let me get that. I'm not sure who's ringing my door. One second. Okay, I don't have someone scheduled, so that's a surprise. I'll go figure that out when we're done here. And then there are a couple of podcasts that I also find not just entertaining, but they're great for lived experience. One is called Something Was Wrong. I didn't put it on here. Something Was Wrong. So each um, season has a different person's narrative about their lived experience. The woman who had just gotten out of the physically abusive relationship, one who wanted to know how will she know she's getting better. She took my recommendation, listen to that podcast. She said it was extremely helpful to see how these very intelligent, very capable, mature, successful individuals still got hooked into these relationships.